As I often do when researching healthcare topics, I scrolled the interwebs and stumbled upon an intriguing study, the Cedars-Sinai Los Angeles Barbershop Blood Pressure Study. This innovative project involved pharmacists collaborating with Black barbers to manage chronic diseases and provide education directly in barbershops. Now, what caught my attention wasn't just the setting, but the results. The patients who worked with the pharmacist saw a significant reduction in blood pressure over 12 months compared to those who referred to their primary care providers. This got me thinking about how culturally competent approaches can address health disparities faced by Black Americans. Barbershops and beauty shops were integral to Black communities growing up, and I spent many years accompanying my grandma to the beauty shop and my dad to the barbershop. And I wonder how my grandparents' and parents' lives might have differed if healthcare had been accessible in these spaces. Hi, my name is Tamisha Campbell from Enhance Black Women's Health, and we help you develop culturally competent practices to reduce health disparities and improve the quality of care for Black women. And in this video, I'm going to share 3 strategies for improving your practice's cultural competence and making a meaningful impact. However, there is a 4th thing that you can do too, so make sure you stick around until the end to hear it. Now, the lessons from the LA Barbershop Study are invaluable, especially for healthcare providers who are aiming to deliver equitable care. So let's dive into 3 strategies you can use to enhance your practice's cultural competence. 1. Recognize that health disparities are not your patient's fault. One critical insight from this study is that deep-rooted mistrust of the healthcare system among Black communities stems from systemic racism as well as exploitation. So by bringing healthcare to a trusted space, the barbershop, pharmacists were able to bridge this gap. And for healthcare providers, acknowledging this mistrust is the first step toward building authentic relationships. Imagine implementing a similar model for Black women in spaces they frequent, such as churches or sorority meetings or fitness groups. These environments foster trust and comfort, which allows providers to address healthcare concerns. And through awareness and proactive engagement, providers can ensure that Black women receive the care they deserve. 2. Partner with trusted community leaders. Now, the barbershop study succeeded because of the barbers' buy-in. These individuals are community pillars, so collaborating with trusted leaders, whether they're pastors, sorority alums, or local advocates, is vital for healthcare providers. However, partnership requires careful consideration. Leaders have to genuinely represent and resonate with the community's values. Engaging with the wrong representative can inadvertently harm your efforts and in many ways reinforce mistrust rather than alleviate it. Therefore, whoever you work with, ensure that you build relationships that are based on mutual respect and shared goals. And 3, adapt to evolving community dynamics. The COVID-19 pandemic really did reshape how communities gather and interact. For instance, barbershops were once bustling hubs, and now they often require appointments or operate differently. And many businesses that were central to Black communities have closed permanently, which has altered our gathering spaces. So flexibility is crucial for healthcare providers. Consider alternate venues like virtual platforms, community centers, or pop-up clinics. You can effectively meet the community's needs by staying attuned to these shifts. Plus, remaining adaptable ensures that your efforts stay relevant and impactful in an ever-changing landscape. Now, let's get to that 4th strategy I talked about earlier. A strategy that might not be as obvious involves observing what's already working in other practices and replicating what is relevant in your practice. For instance, the LA Barbershop Study focused exclusively on Black men, but this model would also be applicable to other BIPOC populations. And while adjustments are necessary to ensure cultural relevance, don't dismiss that health initiatives in one area must also work in different regions and contexts. So if you want to hear more content like this video and subscribe to the Enhanced Black Women's Health channel. This is a YouTube channel for healthcare providers that focuses on reducing health disparities, enhancing care quality for Black women, and fostering culturally competent practices. So if there are topics you'd like me to cover, please let me know in the comments below. And together, let's create equitable healthcare solutions that genuinely make a difference.